Hello, my name is Rosemary Rocco, and I'm here to present Apgar Assessment of the Newborn. The equipment you will need will be a watch, stethoscope, pen, blankets, towels, and infant hat. The delivery room setup will include a radiant warmer, suction, and oxygen. Personal protective equipment is necessary when performing airway suction. You will need a gown, mask, goggles, and gloves. There are 5 parameters that will be evaluated in Apgar scoring. This is a typical form used to document Apgar at 1 minute and 5 minutes. When assessing the heart rate, you will need to auscultate the apical rate for 1 full minute. You will place your stethoscope at nipple line just to the left of the sternum. If the heart rate is absent, the infant will score a 0. When heart rate is less than 100 beats per minute, the infant will be given a score of 1. And when the heart rate is greater than or equal to 100 beats per minute, a score of 2. You will assess respiratory effort. If there are no spontaneous respirations, the infant will receive a score of 0. If a slow, weak cry is noted, a score of 1. Spontaneous respirations with a strong, lusty cry, the infant will get a 2. You will assess reflex irritability. If there is no response to suction or to gentle slap on the soles, the infant will receive a score of 0. Minimal response to stimulation, such as a facial grimace, the infant will score a 1. Prompt response to suction, with cry or active movement with gentle slap to the sole of the foot or back rub, the infant will score a 2. You will assess muscle tone. If the infant is limp, a score of 0 is given. If there is minimal flexion of the extremities or sluggish movement, a score of 1. The infant will receive a 2 if there is active spontaneous motion or flexed body posture. You will look at color. If the infant is blue or pale, there will be a score of 0. If the body is pink and the extremities are blue, a score of 1. If you assess a pink body for the light-skinned infant, or absence of cyanosis when assessing a dark-skinned infant, the infant will score a 2. Each sign is evaluated at 1 minute and 5 minutes. There is no action required if the total score is 8 to 10. You will continue to observe and support the infant's adaptation to extrauterine environment. Scores totaling 4 to 7 indicate the need for gentle stimulation, such as rubbing the back or oxygen administration. Consider the possibility of narcotic-induced respiratory depression and the need for Narcan administration. Scores less than or equal to 3 indicates the infant need for active resuscitation. If resuscitative measures are applied, add the following scoring chart. You will need to document oxygen administered, positive pressure ventilation, or CPAP, endotracheal tube insertion, chest compressions, or epinephrine administration. Apgar score will need to be reevaluated at 10 and 15 minutes. Now we will go into the simulation lab and review the radiant warmer and Apgar assessment using the simulation newborn mannequin. I have removed my personal protective equipment so that I can give you this demonstration unencumbered. This is the radiant warmer that we will place the infant on after he is delivered. You will turn on the power previously, have it on a pre-warm state until the infant is brought here. There will be a button to turn on the Apgar timer. We are going to look at his motions and activity, noting whether he has flexed limbs. We will look at his color. We're going to listen to his heart rate. You will place your stethoscope at nipple line and listen for 1 minute, noting rate, rhythm, and strength. You are going to look at the infant's color. If the body is pink, if the extremities have any discoloration, such as a blue hue known as cyanosis. We're going to count respiratory rate. You're going to notice if he has what's called substernal retractions or abdominal retractions, noting what kind of effort he is exerting when he is doing his breathing. Notice if his extremities are flexed, if he is moving. We are going to listen to his cry. We would like to hear a strong, vigorous cry. You might hear coughing or sneezing as he is clearing his airway. We want to make sure that he does not have a weak cry. At this point, he will score a 1 for his color since he is pink in the body and slightly discolored in his extremities. He will receive a 2 for every other parameter, giving him a total score of 9. That will indicate that this infant has adapted to extrauterine life. Thank you.